We will now demonstrate the placement of a subclavian vein catheter using a three-dimensional simulation of a patient. As noted previously, the insertion site has been carefully selected. The needle tip should penetrate the skin just below the clavicle, at the junction of the medial and lateral thirds of this bone. The needle should be directed toward the sternal notch, keeping the needle parallel with the rib cage to avoid penetrating into the pleural cavity. Gentle suction is maintained on the syringe. When the needle enters the subclavian vein, blood will be returned into the syringe. The needle should be stabilized with the fingers at the skin puncture site and the syringe removed. Care must be taken that air is not allowed to be sucked in through the needle. An air embolus may be fatal. This is particularly possible if the patient is intravascularly depleted. The flexible guide wire may now be introduced through the needle and passed into the vein. The guide wire will be threaded until it lies within the superior vena cava, and it may even proceed into the right atrium. This may cause arrhythmias, so the EKG must be monitored during this time. The proximal end of the guide wire must be kept under visualization at all times, so that it is not lost into the vascular system. The cordis catheter may now be passed over the guide wire. The guide wire will ensure the large bore catheter enters the vein.